Look forward to speaking a little bit more about the PEACE-3 trial. And as we know, this was a randomized multi-center phase 3 study comparing enzalutamide, comparing that to radium-223 and enzalutamide in asymptomatic or mildly symptomatic patients with bone metastasis, metastatic castrate-resistant prostate cancer. This presentation was given by Dr. Gillison at ESMO earlier this year, and these are the slides from that presentation as well. So in terms of background, we know that abiraterone and enzalutamide are standard of care for patients with metastatic castrate-resistant prostate cancer progressing on ADT. And then the use of radium-223 is different than lutetium-177. And so the differences are that radium is an alpha particle emitter that's selectively targeted bone metastasis because it's a calcium mimetic, and it induces double-strand DNA breaks. So lutetium is a beta emitter and has more radiation safety issues versus an alpha emitter. The ALIMSA trial was a placebo versus radium-223 in patients that were bone or symptomatic bone metastasis. And this showed actually of 921 patients that there was an improvement in overall survival, median survival of 14.9 months versus 11 months, so a 3.6-month improvement. And also of note was an improvement in symptomatic skeletal event progression, meaning that people who got radium, 15.6 months versus 9.8. And this was defined as either the need for radiation, cord compression, pathologic fracture. That'll come back in just a little bit. There was another study called the ERA-223 that actually had a very similar design, but used abiraterone and compared that to radium versus abiraterone by itself. So this study did not show a benefit in symptomatic skeleton event-free survival or overall survival, and interestingly showed an increase in fractures. So about 29% of patients had fractures versus 11%. And again, that's going to be a little bit important coming up. So the study that we want to talk about more is the phase 3 trial. This is the study design. Looked at patients with metastatic castrate-resistant prostate cancer with bone metastasis. Could be asymptomatic or mildly symptomatic, good performance status, and no known visceral metastasis. The randomization was between radium-223 and combined with enzalutamide versus enzalutamide alone. And off note, you can see they did add bone protecting agents, was mandatory after the first 119 patients. Primary endpoint was radiographic progression-free survival, and then we can see the secondary endpoints. This is the results or baseline characteristics of the patients, and they're very well balanced. I think of note is that about 30% of the patients were treated with prior docetaxel, and very few of the patients had prior abiraterone. Most of the patients were able to complete the entire course of radium, meaning the 6 cycles. So in terms of results, this was the primary endpoint, and it showed that for radiographic progression-free survival, there was a significant improvement in the arm with enzalutamide plus radium. So 19.4 months versus 16.4 months median radiographic progression-free survival. With regards to the forest plot, breaking this down a little bit more, I think the hazard ratio was favorable in almost all the other patient characteristics as well. And then in terms of the secondary endpoints, overall survival at an interim analysis was significantly improved with the combination arm. So there was a 7-month improvement, 42 months median versus 35 months. And this was statistic at the interim predefined p-value of 0.0031. With regards to additional secondary endpoints, the time to next systematic treatment, there was an improvement with regards to the combination. So there was at 24 months, 51% of the patients on enzalutamide alone went to the next treatment versus only 30% of the combination arm. With regards to the other secondary endpoints, the time to pain progression and symptomatic skeleton event, there was no difference between the two arms. And I think so that's interesting because, as we know, the LIMSA trial did show an improvement in symptomatic skeletal event. How did the patients do with regards to side effects? Well, the adverse effects were pretty similar between the two arms. I think the death due to drug-related AEs was 0. There were grade 3 and 5 grade toxicities, and most of them being hypertension in the combination arm and fatigue. And if we look at fracture rate, so there was 5% in the combination versus really 1.3%. So I think that this was with the addition of the bone protecting agents as well. So I think my summary, I have 1 minute left. The summary would be that this trial showed its primary endpoint was achieved with the radiographic progression-free survival benefit, and the secondary endpoints of overall survival at interim analysis was met as well. I think we're still waiting for the overall survival analysis again. Thank you.